It's a pleasure to be with you. The title of this talk is Media Influences. There are no disclosures for this presentation. Objectives include review the communications model, including the 7 dimensions of cultural distance, discuss the importance of research to identify the best media channels and media message forms for a community, discuss the importance of working with organizations in a community engagement process. Discuss the importance of horizontal communicators in community engagement and decreasing cultural distance. Review urban and rural attributes and how they relate to community engagement and messaging strategies. Review the 8 general messaging hypotheses. Review the 4 printed mass media suggestions. Review 2 examples of media research, their findings, and how they relate to public health media strategies. Review social media influence on misinformation. Briefly discuss the role of mass media meetings and small group dialogue groups and their potential application to public health messaging, and review the basic concepts of message filters. Claude Shannon and Warren Weaver developed this cross-cultural communications model. This diagram lists parts to consider when communicating from the source to the respondent, including encoding, message delivery, decoding, context, noise, and feedback. Communication is extremely important for productive interactions between individuals and groups. This diagram also lists the 7 dimensions of cultural distance when communicating or interacting with another culture, or even between subcultures within a community or society. The more culture or group X differs from culture or group Y in the 7 dimensions listed on this slide, the greater the cultural distance between those cultures or groups. Those 7 dimensions include worldview or deep beliefs, cognitive processes or ways of thinking, linguistic forms or ways of expression, behavioral patterns or ways of acting, social factors or ways of interacting, media influences or ways of channeling messages, and motivational resources or ways of deciding. This talk will focus on a few basic concepts regarding media influences or ways of channeling messages, their relationship to effective community engagement, and cultural distance. Finding the right message platforms and forms to effectively transfer not only messages from a message source, but also meanings that will positively impact behaviors of the recipient of those messages is essential. Finding that appropriate message information requires media research. Some of that research can be accomplished through a community engagement facilitator completing a look, listen, and learn survey by spending time in the community, listening to community members, formal and informal leaders, observing, gathering information, and learning about the community, their culture, and way they do things. And in this situation, gathering information that identifies appropriate message platforms to transfer meaning that will impact healthy behaviors. The look, listen, and learn process commonly takes months to gather enough information to adequately inform the facilitator. I can't emphasize enough how important it is for a community engagement facilitator to learn as much as possible about a target community and culture. This information is invaluable, providing the facilitator with information to avoid flashpoints that could derail the process It can uncover information about accepted social norms that dictate intergroup and facilitator interactions. It can also help facilitators craft wise, open-ended questions to help move the community toward problem identification and solutions. Notice that I didn't use the word talk in the title of Look, Listen, and Learn surveys, since in community engagement, we are not there to sell our project or coerce a community to do something. In true community engagement, we are there to facilitate the community to own their problems and solutions. It's often useful for us as adults to be reminded of and apply the 4 characteristics of active listening often taught to children. Have looking eyes, listening ears, a quiet mouth, and still body. This is good advice for community engagement facilitators when completing a Look, Listen, and Learn survey in a community. Community engagement is facilitation of a process of problem solving, not accomplishing a project. There is also a role for utilizing expert marketing techniques beyond the facilitator's Look, Listen, and Learn survey process. The main point is to utilize all the research tools available to gather as much information as possible about the community and the message platforms and forms they use to effectively communicate. Let's briefly talk about structures, organizations, and messaging. Every community has structures and organizations. Organizations, by definition, within the discipline of community engagement, are groups that function as change agents in a community. Structures, on the other hand, are groups that tend to resist change to perpetuate a steady state. As diagrammed, there is an innate tension between community structures and organizations, one encouraging and the other resisting change. Communities benefit from a healthy balance between organizations and structures. Urban communities and populations tend to have more organizations, though urban organizational membership is more fluid. Rural, agrarian communities lean toward structures. This tendency toward more organizations in urban areas and structures in rural areas may partly explain why urban populations are generally early adopters of new ideas and change versus rural communities. Community engagement and its associated messaging is generally about positive community change. Therefore, it's a wise community engagement and messaging strategy to work more with community organizations versus structures. So how does one determine if a community group is a structure or organization? The title generally is not helpful. In some communities, the Lions Club, Kiwanis, and Ladies Garden Club may be organizations or change agents. In other communities, those same groups may resist change and be structures. In some communities, faith-based groups are organizations encouraging change, and yet in other communities they are structures. To truly determine if a group is an organization or structure, look at the group's actual outputs. What projects are they engaged in? How do community members describe the activities of these groups? In community engagement and community messaging, it's important to find and work with community organizations. All societies have elements of class and status. Generally, there are 3 social classes in each community: upper, middle, and lower. Class is associated with certain community behavioral expectations that are fairly well defined. Superimposed on the class system is a status system. Status is the social position assigned or achieved by an individual. Influential individuals are located at the upper end of each class in a community. These individuals are commonly informal leaders, also known in the literature as horizontal communicators, peer communicators, opinion leaders, influential individuals in class, and champions. These individuals have exceptional ability to effectively transfer messages and meaning to those in their class, but equal to or below them in status. A horizontal communicator may be recognized as the go-to person for a certain topic area like health, yet may not be a recognized influencer in other topics like spiritual issues, economics, or politics, etc. A horizontal communicator for health issues may be a health professional like a nurse, physician, nurse practitioner, chiropractor, etc. For spiritual issues, it may be a tribal medicine man or woman or elder in a church. For political issues, it may be a community activist. A major strategy of community engagement and messaging is to identify and adequately engage the horizontal communicators of each class in a target community. This is an important slide demonstrating horizontal and vertical communication between classes, which also relates to all social interactions between and within classes. Both horizontal and vertical communication or messaging is important for successful community engagement in changing risky behaviors. Messaging from a higher class to lower class vertical communication generally results in high prestige, medium message volume or capacity, and low to medium persuasion potential. This would be like utilizing a movie or music celebrity or professional athlete as a messenger. Public information officers often seek out these types of individuals since they have broad name recognition, yet realize that these celebrities will only have marginal persuasion potential. They often suffer from silver spoon syndrome. Comments often heard include, "They don't understand the reality of life in my situation. It's nice they care and I respect them for that, but they don't really identify with my needs." Low to higher class communication, we'll call reverse vertical communication, is generally poor, associated with low prestige, message volume, and persuasion. Horizontal communication, or messaging, is generally associated with moderate prestige, but high message volume and persuasion. Horizontal communicators, representing the upper status of their class, live in their community and class, enhancing message volume and persuasion. The utilization of horizontal communicators is a major tenet of true community engagement, finding well-respected individuals of high status within their class who can effectively communicate horizontally within their class. Horizontal communicators are commonly informal, not formal leaders, and therefore often not effectively engaged and used in many community engagement programs. These horizontal communicators have incredible potential to influence community and individual behaviors, and if not appropriately engaged, can undermine community engagement in a target area. Having said that, prestige support, formal leadership support, higher class to lower class communication, vertical communication is also important for successful engagement. An essential first step in community engagement is to obtain formal leadership support for the program or messages. Their support will lend authority, respect, and prestige, though that support may not have great impact on message volume and dissemination or persuasion to all classes in the community. Lack of support from community leaders is devastating to a community engagement process. A main point is that horizontal communicator engagement within each class of a true community is generally the most effective social communication or messaging method to change behaviors. This diagram lists the 5 major groups of communities: a rural town of generally less than 1,000 to 1,500 people, schools, faith-based groups, workplaces, and other organizations that meet the definition of community. Almost all people belong to not just one, but multiple communities. For example, a person may at the same time be a member of a faith-based group, workplace, school organization, Kiwanis and Rotary Club, etc. And all of those groups may meet the definition of community. Each of those communities have a significant influence on the beliefs, values, and ultimately the behaviors of their members. Consistent messages regarding healthy behaviors from all the communities that an individual is a member of will have greater impact than a message from just one of those communities. The multi-community engagement approach will help individuals more quickly reach behavioral thresholds. So a major goal of community engagement and community messaging is to reach as many communities and sub-communities in a target area as possible to enhance the volume of consistent messages that reach their members. The world is generally becoming massively urban. The United Nations Department of Economic and Social Affairs stated in 2018 that 68% of the world's population live in urban areas compared with about 50% in 2000. A comment by anthropologist George Foster seems to apply here, relating to community engagement and messaging strategies. Most social and economic changes occur first in the city among upper classes and spreads downward not only to lower classes, but also from urban to rural areas. So strategically, it may be advantageous to initiate and target change messages in cities or towns with larger populations within a community engagement target area, since influencing change in those larger populations may be easier and also positively influence or stimulate change in surrounding rural communities. Let's consider some common attributes of urban societies and how those attributes might impact messaging strategies. In urban areas, face-to-face contacts are often more impersonal, superficial, transient, and utilitarian. As a result, urban areas are associated with enhanced feelings of loneliness. Individuals lose some of their capacity for self-expression and participation. In large cities, individuals often feel unnoticed and insignificant, a nameless face in an ocean of disconnected humanity. So in urban populations, it's often more difficult to identify true communities and facilitate community engagement. A community is commonly defined by community engagement experts as a group of people who know each other by first name and have a sense of shared responsibility for each other. A community is built on intergroup relationship strength and trust, which is often more difficult to cultivate in an urban environment. So a general urban message strategy could be to increase the use of social media and mass communications to better reach more isolated individuals versus community engagement techniques that capitalize on strong interpersonal relationships. Urban areas are associated with a more secular approach to life. Therefore, many urban residents may not be as interested in faith-based message strategies, topics, and ideas. Having said that, realize that these attributes don't apply consistently to many urban subgroups. For example, faith-based and ethnic subpopulations in urban areas may represent close-knit sub-communities that will respond well to community engagement facilitation. As previously mentioned, urban areas tend to have more organizations and less structures, therefore increasing opportunities for initiating changes. With industrialization, the center of economic power shifts to the city, where a large labor force gathers, a new middle class emerges with a desire to innovate and improve societal problems that impact them and their families. This urbanization phenomena often results in critical changes in the class and status of individuals and groups, kinship ties, education, and shifts from traditional values and belief systems. So message strategies that initially focus on urban areas will tend to be more successful and will also likely encourage and foster a regional change in behaviors as previously discussed. Urban life is an environment that commonly encourages change. Industrial cities are much different from pre-industrial cities. Pre-industrial cities are places where change occurs more slowly. Pre-industrial cities tend to maintain more rural ties and attributes versus industrial cities. Pre-industrial cities, since they are generally more attached to rural tradition, will be more resistant to change than industrial cities. It is important to distinguish between industrial and pre-industrial cities in designing a community engagement and messaging strategy, since pre-industrial cities may be more responsive to rural messaging strategies. Examples of American industrial cities would include New York City, Chicago, Detroit, Minneapolis, and Los Angeles, etc. American pre-industrial cities would include Fargo, North Dakota, Cedar Rapids, Iowa, Springfield, Missouri, and El Paso, Texas, etc. Let's now spend a few minutes discussing some common attributes of rural societies and communities and how those attributes can impact message strategies. There are two basic types of rural communities, city-dependent and city-independent. A city-dependent rural community is reliant on a city for things like finances and material goods. City-dependent rural communities are also significantly influenced by the ideas, beliefs, values, and behaviors of cities. A city-independent rural community is generally physically isolated from cities, self-contained, self-supporting, and self-reliant. There are very few city-independent rural communities in the United States, yet they are quite common in other areas of the world. The following are a few common attributes of rural societies. Rural societies are more traditional in lifestyle and value systems. Compared to urban dwellers, rural people are often more independent, opinionated, and skeptical of others, particularly outsiders and those who try to tell them what to do. As previously mentioned, rural communities tend to lean toward more social structures that oppose change versus organizations that support it. These attributes contribute to their heightened resistance to change versus urban areas and may help explain why new ideas often originate in urban areas and subsequently spread to rural communities, particularly city-dependent rural communities. It takes time and patience to develop enough relationship strength and trust to overcome resistance and effectively facilitate a community engagement process in a rural area. That same resistance to change is a benefit after a positive change occurs, since they will again resist further change. Rural areas often meet the definition of community, particularly if the population is less than 1,000 to 1,500 individuals. Rural societies are more homogeneous, which translates into a flatter social structure. There is less cultural distance between classes. Therefore, vertical communication may result in more volume and persuasion potential in rural areas. Rural communities tend to be relationship cultures that utilize more face-to-face communications. These attributes support the community engagement strategy of utilizing the face-to-face messaging of horizontal communicators to positively impact beliefs, values, and behaviors in rural communities. Rural communities tend to have a more sacred life orientation than urban populations. Therefore, faith-based community engagement and messaging may be more widely effective than in urban areas. This is a summary of 8 general messaging hypotheses to consider when developing a messaging strategy. 1. The more closely messaging follows prevailing social norms, the more effective it will be. 2. Horizontal messaging is of greater volume and is more persuasive than vertical messaging. 3. Vertical messaging and leadership endorsement is important for community programs. Without leadership vertical messaging support, community programs will likely fail. 4. Reduced cultural distance improves message efficacy. That's well demonstrated when message sources like horizontal communicators are from the same culture or community as the recipient. For another example, influence from an industrialized city to a rural community will be more difficult than from a pre-industrial city, since the pre-industrial city is more attached culturally to the surrounding rural community's beliefs, values, and behaviors than industrial cities. In other words, pre-industrial cities have less cultural distance between them and their surrounding rural neighbors than industrial cities. 5. It's more difficult for outsiders to effectively message in strong relationship or face-to-face cultures like rural communities. 6. Multiple media and communication approaches are needed in heterogeneous societies. This would relate to cities more than rural areas that tend to be more homogeneous. 7. The more cohesive, homogeneous, and face-to-face a society, the more likely that effective communications will be horizontal. 8. The more cohesive, homogeneous, and face-to-face the society, like rural communities, the more time and patience is needed to effect lasting change. That patience is rewarded since rural behavior changes tend to persist. These next 2 slides are comments regarding mass media from the 1960s and 1970s. Wilbur Schramm in 1964 stated that mass media can help only indirectly to change strongly held attitudes or valued practices. Mass communications has never proved very effective in attacking attitudes, values, or social customs that are deep set or strongly held. I'm not sure that all current media experts would agree with that assessment from 50 to 60 years ago. G. Ralph Milton in 1971 agreed with Schramm and added, "Enough research has been done to enable us to be certain that a person's communication with family and friends is more significant in terms of attitude change and formation than any or all other media. In fact, this result is reported with almost monotonous regularity. This is especially true of deep-rooted attitudes and beliefs, such as religious convictions." A major point to emphasize from Milton is that messages from family and friends is generally more effective than any other type of media for changing deep-rooted attitudes and beliefs. This is a basic concept of community engagement that aims at influencing the underlying deep beliefs and values that drive risky behaviors. Most media experts suggest that all media is useful when applied in an appropriate situation and time for a given population. That is true of social marketing, community engagement, traditional mass media, small dialogue groups, social media platforms, etc. Understanding when to use what media tool is essential for public health practitioners. The intent of this talk is to hopefully provide all of us with helpful insights to do that. Much mass media content is in print. whether in a traditional format like magazines, brochures, newsprint, braille, etc., or on an electronic social media platform. This slide lists a few key comments to consider regarding printed media when developing a message strategy. 1. It's important to identify the most effective media platform for a specific target population, traditional, electronic, or other. 2. A major question to consider regarding print is, will literate individuals in a culture read printed material to gather information or not? This applies to all potential media platforms, and the answer may not always be yes. If not, other sensory message forms like auditory and/or visual messages will need to be used. A study in the Philippines demonstrated that even with a college education, few individuals will read any literature beyond what's required by their job. A Native American women's health study in North Dakota in 2004 found that only 25% of Native American women gather media information by reading printed material. The result of these two studies underlines the importance of number 3. 3. Identify and choose not only an appropriate media platform, but also the best sensory message form for the target population. Don't just assume that educated, literate individuals will seek information through a written platform. 4. Another key recommendation from cultural communications experts is to encourage the production of contextualized messages from competent message sources from the respondent culture. Assumptions of messaging efficacy are not enough. Media research is essential to determine the best media platforms and sensory message forms to use for each culture and community. Let's briefly consider the results of 2 media research projects and how that data can influence media and message strategies. The 2004 North Dakota Native Americans Women Health Study and the Cornell-Weill Study of College Student Influenza Vaccinations and Programs from 2017 and 2018. First, let's review a few other key findings from the North Dakota Native American Women's Health Study. Participating women in this study made suggestions on how to increase reach and interest in women's health materials. 1. Use tribe-specific Native American artists and graphics. 2. Use handwritten versus computer-generated addresses on the envelopes, enhancing a personal touch, which is important in relationship cultures. 3. Provide a gift with a message, like a dollar, keychain, etc. Tribal cultures often have gifting traditions. 4. Incorporate photographs of tribal-specific members with the messages. 5. Media chosen must have local appeal and deal with the perceived needs of Native American women. In summary, use culturally acceptable and attractively written materials. In 2004, this study demonstrated that many American Indian women subscribed to a variety of magazines. Of those magazines, the Electric Cooperative magazine, North Dakota Living, was deemed the most desirable since it was free and provided women with cooking recipes. The tribal newspapers were also popular but cost money. The national Indian magazine, Indian Country Today, was not widely read in North Dakota since it was considered a newspaper for American Indians living off reservations. So messages in North Dakota Living and tribal newspapers would likely reach many Native American women. The study also demonstrated the value of radio. Every tribe in North Dakota has a tribal radio station. 95% of Native American women have radios at home or in their cars. Most Native American women listened regularly to the tribal radio station, providing another helpful piece of messaging information. The study additionally demonstrated that Native American women in 2004 had the television on for 1/3 of their waking hours. They mainly watched primetime programs. 100% of women watched TV on Monday night compared with 70% on Tuesdays. It was concluded that developing and utilizing North Dakota tribal-specific public service Native American women's health messages on primetime television would be extremely expensive and was dismissed as a viable, cost-effective option for public health in North Dakota. This study data provided tribal and state public health programs with valuable North Dakota-specific information regarding appropriate media platforms and content to message on Native American women's health issues. In 2017 to 2018, Weill Cornell Medicine received a National Foundation of Infectious Diseases grant to help study influenza immunizations in college students. There were 2 phases to this study. Phase 1 was a quantitative study based on a survey of 1,005 undergraduate college students 18 to 24 years old to assess student attitudes toward influenza vaccination and barriers. Phase 2 was a qualitative study of college and university health service providers to assess their experiences with influenza vaccination programs on campus. The main goal of this study was to identify best practices to improve influenza vaccinations in the college population. Let's consider the results of the Phase 1 study that examined how student perspectives informed approaches to improve college student influenza immunization rates. This slide demonstrates student attitudes regarding influenza vaccinations. 51% of students were not concerned about getting influenza, and 59% felt it was unlikely that they would get influenza in the next 12 months. Yet some studies have shown influenza attack rates as high as 73% on college campuses. So students have a misperception of the personal risk of being infected. Yet even with those attitudes, 70% felt it was important to get an annual influenza vaccination, though only 46% typically get one, which may imply a perceived access issue. Students generally have a good understanding of the disease, but poor understanding of the vaccine. 93% know that flu affects all ages, and 91% that influenza causes complications of pneumonia, sinus infections, and worsens chronic medical conditions. Yet, regarding the vaccine, 59% believe the vaccine causes the disease. 51% believe the vaccine causes the virus to mutate and develop resistance to future vaccines, and 35% believe that they will get the flu by being vaccinated. This slide reviews barriers perceived by students and includes: I don't need it, 36%. I don't like needles, 31%. Doesn't work, 30%. I'm worried about risks, 27%. I forget to get it, 24%. I don't have time, 16%. I don't believe in vaccines, 13%. It's too hard to get, 7%. I don't know where to go, 7%. I can't afford it, 6%. Or my insurance doesn't cover it, 3%. The barriers outlined in yellow are likely associated with student knowledge of the disease and vaccine, including concerns about risk, don't believe in vaccines or that they don't work, forgetting to get the vaccine, and a greater concern about needles than the real risk of the disease. This knowledge gap could be addressed by enhanced vaccine information delivered through appropriate and diverse information channels. Several barriers were associated with access issues, including those outlined on this slide. I don't have time. It's too hard to get. I don't know where to go. I can't afford it. And my insurance doesn't cover vaccines. Adequately addressing these access issues will likely help improve student immunizations. Additional student perceptions of access and incentives include: provide vaccines at low cost or free, 61%. Provide monetary or other incentives, 60%. Provide vaccines at multiple locations on campus, 48%. Friends and peers receiving and recommending vaccines, 42%. These would be horizontal communicators. Holding fall health clinics to provide influenza vaccinations and education, 31%. Providing students with reminders via email or text, 26%. Having campus celebrities receiving and recommending vaccine, 18%. These would be vertical messengers or communicators. The 4 top suggestions being providing free or low-cost vaccines, provide incentives, provide vaccines at multiple sites, and peers as examples and recommending vaccines. Notice the difference between the perceived importance of celebrity and peer support for immunizations. 18% for campus celebrities and 42% for peers. These perceptions support the statement of Milton that a person's communication with family and friends is more significant than any or all other media, and underlines the concepts of vertical and horizontal communicators we previously discussed. Vertical and horizontal communicators are both important, though there is greater persuasion potential in horizontal communicators like peers. Once again, the 4 top student suggestions for improving influenza immunizations being: providing free or low-cost vaccines, provide incentives, offer vaccines at multiple sites, and utilize peer horizontal communicators. This slide lists more specifics about student-suggested incentives, including free food on the top of the list at 31%. A big campus influenza event in the fall with free food, free or reduced cost vaccine, live music, an opportunity to meet campus or other celebrities, those vertical communicators, get influenza information, and generally have a campus meet and greet party. Bookstore discounts were next at 13%, holding a raffle for gifts, 11%, a school health day with extended influenza clinic hours, 8%, an opportunity to give back, 8%. In-school competition was low at 2%. Intra-school competitions may not be of great interest to this current college generation. So free food and holding a fall big campus influenza event represented 57% of the student-suggested incentives to improve campus influenza vaccinations. This slide outlines decision influencers for students choosing to get the vaccine. The greatest influencers being, in decreasing order, parents, guardians, family members, followed by healthcare providers, having a student healthcare center on campus for access, and peer or horizontal communicators. Note the incredible influence parents, guardians, and family have on the health-related decisions of students. Parents, guardians, and family members were of greater influence than the internet, traditional media, and even social media in this study. Notice that vertical communications, including public figures or on-campus celebrities, were not very influential, as expected from our previous discussion. There are three general ways or levels to communicate messages in humans. These levels are part of the human primary message system. The first level is the formal level. This is essentially trial and error. Unfortunately, having to use the trial and error process is often dangerous. In health messaging, we try to avoid this way of learning. For example, a person may learn by personal trial and error that smoking actually causes cancer after smoking for 20 years. That message was too late to prevent disease. Second is the technical level. This is essentially a lecture format where a teacher presents information and tries to convince or persuade students to accept and believe the information delivered. This is one of the most common communication tools of traditional public health. Third is the informal level. This utilizes the innate desire of people to imitate role models. These role models may range from parents and family members, peers or horizontal communicators, community leaders and celebrities, etc. Experts contend that a great part of culture, including values and worldview, are communicated at the informal level versus the formal trial and error or technical teacher levels. For example, children learn early basic language skills via imitation of parents, family, and community members as they speak. This took place outside of awareness in the subconscious. Later, language learning was reinforced and refined by the technical level via teachers. Edward Hall's most important counsel is that if we want to introduce changes, particularly in basic beliefs or behavioral patterns of a culture, we must introduce or at least mightily reinforce at the informal, out-of-awareness level. If this is true, much traditional public health communications to change high-risk behaviors may not be focused at the most appropriate level, the informal communications level. The informal level of communications is targeted by community engagement programs through the personal actions and behaviors of horizontal communicators. Community engagement also uses horizontal communicators at the technical informal teaching level. Once again, the technical level of teaching is more effective when reinforcing what is being learned at the informal imitation level. Sequencing is important. Informal level followed by the technical level of learning seems most effective. This is an example of the importance of informal imitation level learning, demonstrating the family influence on tobacco use reported in the MMWR in 2001. In that study, 34.5% of high school students and 15.1% of middle school students used tobacco. Yet 70% of middle school and 57% of high school students who currently smoked lived in a home where someone smoked cigarettes. Smoking of students was markedly higher in families that smoked. Peer pressure wouldn't likely explain this observation. Transfer of messages and meaning, whether good or bad, is more effective in many instances through the family and relates to the informal imitation level of learning. This was also demonstrated in the student influenza vaccination study. The example and recommendations of family members significantly influence health behavior decisions of students and young adults. So the major student influencers to get influenza vaccines were family members, healthcare providers, access to campus student health centers, and horizontal peer communicators. Once again, This type of research is important to designing public health programs, including media platforms and message forms. Media research is critical for public health. Social media has become a major source of media information worldwide. Overall, people spend almost 2 hours a day on social media, or about 15% of their awake time. A study published by Moorhead identified 6 potential benefits to public health uses of social media. Increased interaction with others, more available, shared, and tailored information, increased accessibility to health information, potential to provide emotional support, public health surveillance, and potential to influence health policy. Limitations of social media include quality and reliability of the information and concerns about confidentiality and privacy. Research from Harvard Center for Health and Happiness suggests that the way people use social media may have a greater impact on the health factors of social well-being, positive mental health, and self-rated health than the frequency and duration of use. They identified positive and negative impacts. Routine use of social media by mindful users as part of a daily routine was positively associated with all 3 health factors. Social media use may also help compensate for reduced face-to-face social interactions, help overcome distance and time barriers, and expand and strengthen interpersonal interactions. A negative impact on all 3 health factors was observed in individuals who excessively checked their social media apps out of fear. These individuals could potentially benefit from effortful control skill interventions that improve their ability to self-regulate. Social media use has been associated with increased depression and anxiety in young people. So social media can have both positive and negative influences on health factors. Let's consider some social platform usage studies for a few minutes. 72% of American adults say they ever use social media sites. There are age differences, as might be expected. 84% of adults aged 18 to 29 years old, 81% of those 30 to 49, 73% of those 50 to 64, and 45% of those 65 and older have used social media sites. As of 2021, YouTube and Facebook dominate the online landscape, with 81% and 69% of adults using these sites respectively. 40% of adults used Instagram, with the other social media sites at 31% or less. YouTube and Facebook were the most commonly used social media sites for all adult age groups. For adults under 30, the use of Instagram, Snapchat, and TikTok stood out. There were some racial, gender, and geographic differences noted in social platform usage. 52% of Hispanic and 49% of Black Americans used Instagram, compared with 35% of white Americans. 46% of Hispanic Americans used WhatsApp versus 23% of Black or 16% of white Americans. 51% of individuals with a bachelor's or advanced degree used LinkedIn, compared with 28% of those with only some college experience and 10% of those with a high school diploma or less. Women continue to be far more likely than men to use Pinterest, 46% versus 16%. 17% of urban and 14% of suburban adults used Nextdoor versus only 2% of rural adults. These last few slides demonstrate the importance of obtaining and analyzing current social media use data in developing public health social media strategies. The World Health Organization defines the word infodemic as false or misleading information in digital and physical environments during a disease outbreak. It causes confusion and risk-taking behaviors that can harm health. It also leads to mistrust in health authorities and undermines the public health response. On October 17, 2021, National Institutes of Health Director Francis Collins said, "I think we underestimated the vaccine hesitancy issue. I wish we had somehow seen that coming and tried to come up with some kind of myth-buster approach to try to block all the misinformation and disinformation that's gotten out there, all tangled up with politics, and which is costing lives." The impact of social media misinformation on COVID vaccinations is mixed. A survey experiment from the United States and the United Kingdom found that online COVID misinformation reduced subjects' vaccination intentions. Another WhatsApp study from the United Kingdom found that misinformation had no effect on subjects' COVID beliefs. A similar Brazil-based experiment demonstrated that social media COVID misinformation reduced belief in that misinformation. It's clear that public health would benefit from more research on the impacts of online health misinformation on outcomes. It's not surprising that there is evidence that the algorithms used by social media platforms to push posts consistent with the current interests and beliefs of users enhance the user's politicization and polarization. How to deal with these algorithm issues is a challenge for public health messaging. Some interventions may reduce the impact of online misinformation. Facebook users who were encouraged to follow alternate media sources tended to do so, which led to some depoliticization. Interventions that encourage reductions in social media use can also be helpful. Alcott showed that users who temporarily deactivated their Facebook accounts had less polarized comments after deactivation. Interventions that reminded users of the value of accurate information had an impact. Pennycook demonstrated that sending Twitter users an accuracy message significantly reduced the extent to which they shared inaccurate information. An interesting study from the UK showed that engaging users in the creation of misinformation reduced their acceptance of misinformation. They felt this intervention inoculated the users against misinformation. There is evidence that increasing a user's exposure to reliable information decreases the acceptance of misinformation. Breeza demonstrated that increasing Facebook ads about the dangers of travel during the 2020 pandemic holiday season decreased user distance traveled and resulted in reduced COVID-19 infection rates in intervention counties. Mooring found that increasing exposure to accurate COVID vaccine information resulted in increased COVID vaccine acceptance by individuals. These studies may suggest a few approaches to address social media misinformation. There is limited evidence on impacts of interventions to address offline health-related misinformation. There are a few studies showing that increased exposure to offline reliable health information increases the acceptance of that information. The channels of that offline information include mail letters, email, text messages, and mobile apps. These message venues have been shown to increase influenza vaccinations. Several studies have shown that short message services like text messaging increased the reporting of COVID symptoms, decreased travel, increased hand washing, and mask wearing to decrease COVID transmission. Text messaging for highly politicized interventions like COVID vaccinations have shown mixed results. There are a few studies of informational interventions that may mitigate misinformation for disparate populations. Elson and Torres found that physician COVID video messages, particularly those delivered by race and ethnic concordant physicians, increased COVID-19 knowledge among Black and Latinx subjects. More research is needed to identify interventions that can mitigate disparities in information uptake around the globe. Let's touch briefly on two other media message venues, mass media meetings and small dialogue groups. Mass meetings or mass media events can help move fence sitters to a point of decision, but decisions, especially life-changing major decisions made during a mass meeting, often requires face-to-face follow-up to encourage persistence of new behavior patterns. For example, mass faith-based meetings and political rallies are effective in bringing individuals to a point of decision. Yet a crucial factor after that decision is follow-up. Most organizations understand that face-to-face visits should be performed soon, ideally within 24 hours of a major decision made at a mass meeting, to answer questions and provide encouragement to persist. Personal follow-up after a mass media event is important. Small group dialogue is an important message media venue for several cultures. A variety of other media can be used to enhance small group dialogue, including videos, television, radio, movies, written material, etc. Small groups encourage active participation of members and intra-group communications. As we've discussed, many cultures and communities desire to receive information from peers or horizontal communicators. That communication is more effective face-to-face or within small groups like the traditional talking circle commonly used in Native American communities. Small groups can also provide essential effective follow-up support for individuals who made life-changing major decisions at a mass media event. A recipient message passes through 4 message filters on its path to message impact. Those filters include 1. Exposure to the message. This relates to the time of exposure. If the right media is used, the time of exposure also increases since recipients will be regularly accessing that media channel. Utilizing multiple media channels and repetition of messages will also increase message exposure. 2. Attention of the respondent. Is the message topic and message presentation or delivery of interest to the recipient? Can the message override the noise or confusion arising from other sources? Attention is increased if the recipient has respect for the messenger. 3. Comprehension. Do message recipients understand the terminology, grammar, and language used in the message? Recurrent messaging will not only increase exposure as previously mentioned, but also increase comprehension. Does the message make sense to recipients? 4. Retention. How important is the final meaning of the delivered message after having passed through the first 3 message filters? Is this issue addressing the perceived needs of the recipients? The goal of a media messaging strategy is to increase the intensity of all these message filters, to increase the transmission of the message, and more importantly, the appropriate meaning to positively impact behaviors. In summary, decreasing cultural distance will enhance the appropriate transfer of messages and meaning to recipients. Work with organizations versus structures when facilitating community change. Vertical and horizontal communicators are both important in community engagement. Use messaging strategies that capitalize on the attributes of urban and rural areas. Research to identify appropriate media channels and message forms. Develop public health strategies to adequately address misinformation. Develop message strategies that will enhance the 4 message filters and message impact.